So you should all be able to see my PowerPoint at this moment. Just as a reminder, this meeting is for health department personnel and school employees and administrative staff. The slides and the video will be posted publicly. We just like to reserve this time to make sure that everyone has a chance to ask questions. Make sure any needed information gets passed down to those in your school that may need it. First of all, the good news, we did get approval, or I should say authorization, for the Pfizer vaccine to be used in all those 12 and above. We are vaccinating those age groups at this time. So if you would like to promote that, or if you have people that are asking questions, they can go to vaccinefinder.org or one of our websites, or call 211 or the state COVID hotline to find about locations, times, clinics to get vaccinated. If your school would be interested in having a vaccination clinic on your property or anything like that, we'd be happy to help with that, so give us a call. I did put some links for resources, so if you want to provide any information, or you have parents or teachers or students or anyone that has questions about vaccines in this age group, that information is available. And so again, when we share out the slides, these links will be available for you. So the next topic, some of this is duplicative from the email that you all should have gotten on Saturday from us, but just kind of the elephant in the room. We know there's been a lot of strife and confusion and frustration with quarantine. We know a lot of it did stem from a press release that a few counties put out on Friday. In that press release, they stated that MDHHS advised them that their enforceable quarantines must now be done by local health departments. That was just blatantly incorrect. MDHHS never had any orders or enforcement for quarantine, and at that time, really very few health departments ever issued any orders for quarantine. We've been asking the state to try to put out some kind of statement to clarify that more, but it is a little delicate of a situation. They did add to the FAQ page for the epidemic order, just above where the dining FAQ section starts. They did add a question to try to address this about whether or not the gathering and face mask order requires people to quarantine. And it says in there they continue to recommend that people follow the guidelines, but that their gathering and face mask order issued on May 4th, which is the most recent one, does not mandate either quarantine or isolation, and that local health departments may issue orders. But of note, none of the previous gathering or face mask orders or the executive orders ever ordered quarantine or isolation. So far that's the most we've been able to get out of them in terms of clarification for that. But unfortunately, the media coverage has been really frustrating and confusing. So we completely appreciate what the last week has been like for everybody. It's been really, really challenging and confusing. Just some more clarification, the My Safe Schools Return to School Roadmap has in there that the only requirement was that you cooperate with a local health department if a case is identified, specifically that you must collect information on close contacts. There's a strongly recommended section that says that local health departments will ask close contacts to self-quarantine. That is the only thing that is in that roadmap. The local health department, specifically our health officer, has authority to order quarantine. And I put a bunch of links there where it's more easily understandable, because it is kind of confusing to try to read the public health code. But we do have, or he does have that authority, but to date, none of our health departments on this call have issued those orders, or do we plan to, for the reasons I kind of outlined in the letter from Saturday. Basically, we have to send out a written order to every single person who's in quarantine. If they choose not to follow it, we have to go through the prosecutor and, get legal action. And by the time that's done, they're usually out of quarantine. Plus, we have to have a cooperative legal system in that county. And so it's just unrealistic. Within those links to the Network for Public Health Law, it does discuss, I believe it's in the second link I list there, schools do have the power and authority to protect the health and well-being of your students. So you do have the authority to exclude students that are in quarantine. But we encourage you that if you have questions or concerns about any of this, talk to your legal representative, and also review what it was that you had said was your plan in the My Safe Start COVID preparedness plan for your school. At this time, our guidance is the same. We still recommend quarantine of all close contacts. We recommend that they be quarantined for at least 10 days, and that those last 4 days, they make sure to continue to monitor their symptoms really closely. 14 days is the safest. There is still a risk in those last 4 days. We do not support a 7-day quarantine with a negative test. We know that there are some that are doing that, but there is about a 1 in 5 risk that in those next 7 days, those individuals will become contagious. Just so you are aware, there is a work group between local health departments and the state, and we are working on some alternatives for students that are exposed in the classroom, some alternatives to quarantine. So that is in discussion, that hopefully will be finalized soon. So this, like I've said before, these are things we actively look at, the science, the data, the risk versus benefit. There's still always a risk, and I'm going to go into that here in just a minute. The other thing too is there is a really good guide to communicable disease management in schools. Most of our health departments send you a link every year to it. Just to know that, quarantine is a standard tool that we use in some more difficult to control and more dangerous communicable diseases. In the guide, you'll see that for primarily measles and chickenpox, we do use quarantine still. For whooping cough, it doesn't really say it clearly in there, but while people are getting prophylactic antibiotics, they are still quarantined. So this is not a new thing. This is a very tried and true public health tool. It's just that we don't have to use it often or in such large scale. But I know it's a frustrating thing. So just kind of some exceptions to everything I just said. When it comes to your staff, there is a law that your state senators wrote and was signed into law last year that does require quarantine and isolation for your employees. So that's separate from MDHHS, that's a state law. And then the MIOSHA emergency rules also have requirements for quarantine and isolation. So those are the two exceptions that don't include students. It affects your employees and things you have to do as an employer. So I have been able to get some data. There's always issues with this kind of data, but some of you may be familiar with TraceForce. TraceForce is a system that the state was able to set up because the local health departments were so overwhelmed with so many cases and close contacts. So this is a system and additional workforce that they hired to help follow up on close contacts. And so they went back for us and looked at all the close contacts that were in person, not remote learners, but in-person students in the K through 12 system. They were identified as close contacts from September 26th through April 20th. Almost every health department, all but 2 health departments in the whole state use this. So it was a large amount of the state they were able to look at. The limits on this is that the sick person has to be investigated properly and fully so that we're able to get the right contact, identify the right close contacts, get the right phone number, that kind of thing. About 10% of the people that they try to call don't have the right contact information. Then that person has to actually answer their phone call and be willing to talk with them. And about a quarter to a third of people won't answer the phone, won't talk with them, won't give them information. Any information they have about whether they test positive for COVID or whether they end up having symptoms is all self-reported. And with this age group, between 16 to 50%, so up to half of them, especially the younger ages of infected kids, will never have symptoms. And we all know that not everybody who's exposed goes and gets tested. So we really don't know a good answer to, well, how many of these kids get infected that are exposed because of that, because a huge percentage of them never have symptoms and they don't all go get tested. Plus, a lot of kids have goofy symptoms, as you all know. They may just have a bellyache, they may just have a runny nose. So again, those are all issues with this data. So those are all my, keep those limits in mind as I show you this next slide. So with all that in mind, there were a total of 41,273 K through 12 students that were followed by them as close contacts in that time period. They did have drop downs where they were able to identify if they knew who they were exposed to. One of those drop downs was a school classmate. Unfortunately, they didn't have like in-school exposure, so it would take into account if it was a teacher or a coach or something. It was only a classmate, but at least it was something. So of those who knew who they were exposed to and identified it, 19,470 said they were exposed to a classmate. So of the total, 3.4% went on to test positive, 8.7% went on to have symptoms. And that's without testing positive. So in total, 11% of all the students, regardless of who they were exposed to, went on to become either a confirmed or a probable case, because someone who's exposed and has symptoms is a probable case. Of those who said they were exposed to a classmate, 1.3% went on to become positive, 4.7% developed symptoms. So overall, 5.7% of them went on to become a probable or confirmed. And we've always known that, if you're exposed to a family member, your risks of getting infected are way higher than in any other setting. Now, as a comparison, I pulled up a report from a few weeks ago that gave the rates of infection or positive test results in the asymptomatic athletic testing. And so from February 6th through April 17th, they had tested just over 142,000 asymptomatic athletes, and just over 1,700 of them, or 1.23% of them, were positive. The age group is a little on the older side. It's not the K through 12, it's more your middle schoolers and high schoolers. But just to try to have an idea of what our baseline infection rate is in our healthy asymptomatic kids, it's around 1.2%, compared to those who have been exposed in school or by their classmates, it's 5.7%. So again, it's just at least something. Now, many people would say, well, that's hardly anything. It's just a few extra kids. It's all, I guess, in how you look at it. The way I see it is that those kids then go on to infect a quarter to about a half of their household contacts. And then they may infect others, and so on and so on. So, just things to keep in mind. I did find this was a nice review. I don't know if anyone has heard of the Cochrane review. The Cochrane review is one of the premier and really long-lasting evidence-based medicine engines. I mean, that's all they do is try to find evidence-based medicine and what's proven by research. So they did a review in September to see how effective quarantine is. There are limits to this as well. They said, if you read more of the report, a lot of these studies they looked at were based on like mathematical modeling, because it's hard to really know, unless you take a huge population and don't quarantine them and see how many people get sick. And so, so it's based on reproduction numbers and different things. But anyway, they estimated that quarantine alone for COVID-19 reduced, between 44 and 96% of new infections, 31 to 76% of deaths, 37 to 88% of viral reproduction. And it works better if you combine it with social distancing. Luckily, they didn't find that closing schools made it work any better. So that's a good thing to see. Again, I know there's a lot of argument about, well, kids aren't as infectious and they don't spread it as well. And that's very argued. But I just wanted to share, again, that there is a public health reasoning behind quarantine. So I'll leave that discussion there, and we'll go to our data at this point. So this is for this past week. The state, here, I'll try to blow it up a little bit for you. The state is at about 253 cases per million, which is down about 100 from last week. And the percent positivity is at 9.8. It was 12% last week. The 6 counties of Central Michigan District Health Department is at 325.6 per million. Last week it was 371, and percent positivity is at 11.8. Last week it was at 13. We do have some counties that are still pretty high. Aranac and Clare are still in the 400s. And then, Roscommon and Gladwin, who used to be our high ones, are now getting in the lower end. So, there is obviously variability from week to week. Our 10 counties of District 10 are at 256 on the average per million. And last week they were 307. Percent positivity is 13.1. Last week it was 13.7. This is the first week where we've not had any county in the 20 percentile range, which is very good to see. So things are moving in the right direction. And then the 3 counties of mid, averaging at 307. Last week was 392, and then percent positivity was 11.8. Last week was 12.5. So things are moving in the right direction. I did just want to point out, and really I'm not trying to be a downer, but this was our low in February, just as a comparison. The state average was at 84 with a percent positivity of 3.6, and our districts were in the 60, 80 range, and percent positivities were in like the 2 to 4 percentile range. So we are getting better, but we are still way, way higher than we were at our low part in February. So we still want to be cautious and hope we continue to see things go down. Looking at the state report, again, percent positivity is down and case rates are down, but Michigan is still right up at the tippity top of the country in terms of highest case rates. Our hospitalization and ICU use is down for COVID patients, but we're still at the highest for the country. And our death rates are decreasing, which is great. And luckily, we didn't have the highest number of deaths, but we have had the highest death rate in the last week. So again, we're still up there. So hopefully we'll start to stop being the winner at these numbers. These are not where we want to be number one. But we can see our curve here. This is our percent positivity for test results, continuing to come down, but you can see, we're still up there. She didn't include a curve like that for our cases per million. So I pulled these from the My Start map. This on the top is the last 3 months. This dotted line, again, is just where the data is not really accurate because they go by date of symptom onset. So as people test positive down the line, these data points get more accurate. So again, we're coming down, but we're still, not anywhere near where we'd like to be. But again, we're getting there. we're on a good trend. And this bottom one is the entire data set. And again, you can see we're hopefully getting closer and closer to a good point. These are the age groups. The colors are really scrunched up here. I didn't put in a blown up picture because I think that just kind of gets busy. But I did list them in order. The 10 through 19 age group continues to be the highest new case rate for any age group. It has been that way for numerous weeks. And then the 0 to 9 age group is again higher than these bottom 3 age groups again. I put the 70 through 79 and the 80 both as number 8 because they're basically neck and neck. So that's not a typo. I did that on purpose. Our variance, it's almost like, why bother reporting this? We're pretty much all variance now, to the point of where they're not variance, they're the norm. We're over 70% of B117 are the genotypes that we're testing. Here on the left, this is the country as a whole. These blue colors are the strain or the variants. They're not strains, they're variants that we don't really have concern about. So you can see that almost all of this is now that we're testing for in the country is now of concern. We are starting to see some of the Indian strain creep into the US, and there's been a tiny bit in Michigan. So I know that is one thing that the medical experts at the state are really concerned about and watching closely. So our hospitalizations, again, continue to go down, which is wonderful. That is definitely a huge improvement. The lab turnaround time continues to get quicker, so that's very good. The school outbreaks, there were 67 new school outbreaks this last week. They didn't have a breakdown about where they were, but in the 19 counties that I'm talking to right now, there were 3 new outbreaks in junior highs, 3 new outbreaks in high schools. So we still have some activity. In terms of new outbreaks, though, we had the same total as we did last week, a few more cases than we did last week, and our ongoing outbreaks are slowly starting to come down. As we get further and further out, luckily they're starting to drop off. So hopefully we'll not see those big outbreaks anymore. This was just one of those projections that they often set on there that the U of M School of Public Health has done. So if we continue along this trend, they see us getting back down to where we were at our low in June. They have it broken out by region though, and it's kind of unusual. For example, like Traverse City region, they show kind of this upswing again. So basically, I try not to make predictions because you just never know. But if we continue with following our prevention measures and we really keep vaccinating, hopefully we'll be able to enter summer at a much better place. So that's all for my slideshows. I will try to find okay, so I'll stop sharing and I will find the beginning of my questions here. If you have any questions, just add them to the chat, and then at the end, I'll open it up to any callers that don't have access to the chat. So we are seeing several district health departments move to 3-foot standard for contact tracing in schools, requiring masking and enhanced mitigation measures. Is that being considered? Okay, so again, like I said, we're talking about some different options with the state. One is, in my opinion, it's really good to try to have something standardized throughout as much of the state as possible. And I personally find it really frustrating when numerous different health departments are doing numerous different things because we all border each other. But the other thing is, a close contact is someone who's within 6 feet and likely even a bit further, because that's just how droplets spread. The 3 feet issue has been discussed because in some studies, they're finding that kids in school may not be as likely to get sick even when they're within 3 feet. And they may just not be getting as sick in general just because they're following good prevention measures. It doesn't mean, though, that the way COVID spread has changed. And so the definition of a close contact really needs to say 6 feet. So at least you can notify those people that are within that 6 foot window. So again, there's some discussion going on. We're trying to come to an agreement, but I understand that rationale. And I'm not really at liberty, I don't think, to say what the plan is, but there should be some dramatic, very dramatic reductions to those who are going to need to be quarantined. But again, just for the sake of notifying parents of exposures, the definition of a close contact wouldn't change. Hopefully that makes some sense. Any thoughts regarding messaging for mitigation protocols for next school year? I know we are several months away, but as you can imagine, staff is asking questions. You know, I don't know. I think given, my hope is that we'll be able to do a lot less in terms of masking and things next school year, but I think it's going to be dependent on our vaccination rates and things like that. So again, it's really difficult to predict the future, even if it's just a few months ahead. So I would just say we're going to have to wait and see as that time gets closer, because it really does depend on what are the rates like, are there new variants, how many people are vaccinated, is the virus that's circulating still responding to the vaccine? So it's really unfair to expect you to know what next August is going to look like, even though that doesn't seem that far away. A lot can happen between now and then. What is the timeline for this update on the 3 foots for corn? So again, we're not, it's so hard to beat around the bush without being frustrating for you guys. Hopefully by, well, we were hoping for Friday, but I don't know. Hopefully by early next week, we'll have some changes. And again, it would get rid of a lot of the current recommendations, I would say. So the next question is the same. If we have a group of more than 100 students outside at a time, do they have to continue wearing masks?
Dr. Morse, I think that's detailed on the FAQs for the state EEO, or the epidemic orders in an infographic. I can probably post it if you'd like.
Okay. Yeah, I'm just trying to think and my brain's not shifting gears to that quickly. Is Central Michigan District Health Department going to consider vaccine clinics at school sites? Yes, we've already held some vaccine clinics at school sites. So if you're interested, then give us a call. I don't want to give out wrong information, but just talk to your your county nurse, or so. I don't know who the point of contact would be for that. But yeah, we've already, we had one at Beaverton on Tuesday, and I know we've had them at some other locations. So that was the last question in the chat box. If anyone has, oh, there's another one. The health department has the authority to order quarantines. The school has the authority to exclude students. How can I, as a non-health expert, where is it? It keeps jumping. People keep adding questions. How can I, as a non-health expert, defend ordering a student excluded when the health department will not? So you have and anyone of the health officers can jump on. So you are following the health department recommendations to exclude a student from school. So that is your defense, is you're following public health recommendations.
Yeah, Dr. Morse, this is Marcus from Mid-Michigan. And it's also, of course, in the administrative orders where it calls out schools and health departments together. And I think the other piece of it is when we know we're dealing with a global pandemic that has, killed 30,000 Michiganders, how can we not quarantine? It is the only tool we have to stop this pandemic. And then again, there's also the liability issue. If schools and health departments don't do their jobs when we know people are at risk, I mean, I can't think of a reason why we wouldn't do this.
So again, I do know some schools that have talked with their legal counsel and they've given them the legal jargon as to why they can do this and should do this. Can businesses require that student volunteers and parapros be vaccinated? If so, is a school employee able to ask students and staff if they have been vaccinated? So employers and businesses can require vaccination. I don't know, and again, this is all legal FERPA, HIPAA stuff that I'm not great with. To just upfront ask somebody, are you vaccinated? I don't know, I don't know if that's allowable unless you are requiring vaccination, which as a school, it is not one of the required vaccines. So I don't know that that would be something allowed. But private businesses and healthcare organizations and colleges can write rules that do require it. So I don't know if that answered that question, but I really don't know how to better answer it. Any possibility of getting a kids clinic at school prior to the year ending? So that's for Chip Hills, Mecosta County. I don't know if anybody's on from District 10. If not, Bob, I will reach out to them. I'm making myself a note. So I'll reach out to District 10 and see if there's any way that they can reach out and see about getting a vaccine clinic set up for the school. With 55% of Michigan vaccinated, employees can now return to work. Well, it has to be 2 weeks after that date. Do you know if the state is actually going to come out and indicate that employees must return to work? What is your recommendation? Well, I know it has to be 2 weeks past that point. And then there was fine print on that original Vac to Work plan that said rates need to be below 250 per million or something to that effect, that there may be some additional judgment if the rates are above 250 per million, and it was really tiny print. I don't know how it's going to be worded. I suspect it's just going to take away the wording that says those who can work at home must work at home. My feeling would be that if you can work at home, you can work at home rather than you must work at home. And I think realistically, going forward, that might become one of the end products of the whole pandemic, is just we have a bit of a different working environment, but we'll see. But again, there is some fine print on that back to normal plan. Can you share the link to the administrative order that contains that statement? If it is an order, then it makes it easy to follow and defend. Yeah, I thought I had shared it in a previous email, or I know what it was. I had shared it in last week's PowerPoint, but I can share it again when we're done with the question and answer, because I know if I try to do that while I'm talking, I'll get myself all screwed up. Students are not quarantining from each other when they are quarantined from school. It creates more of an opportunity for the students to hang out without any safe protocols that school provide. Yep, but I don't know what to really say to that. And I brought that up once with a healthcare professional, and she said, prove it. So it's just difficult. I know it's really difficult. Vestaburg and Lakeview are also interested if possible. So that's basically, I'll just tell all my health departments to reach out to all their schools and see if anyone's interested in a vaccine clinic. Given how close it is to the end of the school year, we'll see what's possible. Wouldn't schools need that info? Need what info to determine if quarantine was required or not?
Hi, Dr. Morris. This is Brooke in Manistee. The info of whether asking your staff member if they've been vaccinated or have had COVID within the 90 days to determine if they need the quarantine or not.
Okay. And that, again, if you have a reason for needing to know it, you can look up MICR on your students if you need to know it. Just randomly asking them is, obviously kind of an odd thing, but if it was to determine need for quarantine, that is a bit different. If they don't want to talk to you about it, we can always get involved and talk with them.
I was referring to staff.
Yeah. So most of the time, employers are able to ask the staff member and they are able to tell them. But again, if it's a matter of proof, then you can call us and we can confirm that by looking in their MICR record. Because I wouldn't encourage you to look up any staff member's MICR. According to Thrun law, the MIOSHA ruling now in effect requires people to work from home if they can. This is in effect correct. It was extended for 6 months, so it's through October. It says those who can work from home must work from home. So with the back to normal plan, that would be changed, and that part of the order would be taken away. If MIOSHA feels it is safe to do, which again has some wording in there about cases have to be less, may need to be less than 250 per million, et cetera, et cetera. I really feel like they kind of have to do it at this point. If it's not done, it's going to be a problem. But yes, that is what would change, would be that MIOSHA rule. I'm going to start pulling up that administrative rule. And if anyone else has any other questions, go ahead and add them into the chat or unmute yourself and ask a question. Trying to find where I put it. Okay. So here's the administrative order for communicable diseases. And on page 6, it says, when a school official reasonably suspects that a student has a communicable disease, except for HIV and non-communicable diseases, the official may exclude the student for a period sufficient to obtain a determination by a physician or local health officer as to the presence of a communicable disease. That does cover quarantine because we have to assume that they're infected because of the contagious nature. I am not a public health law official or specialist, which is why I also provided in the PowerPoint today links to the Network for Public Health Law, because they have other extrapolations and interpretations of that. And they also have contact info for their Midwestern branch, which covers Michigan. So you can always contact them to get more information too, but that's been the section that we've been referred to as to why and how schools have the authority to exclude people who've been exposed to communicable diseases or have communicable diseases. So are there any other questions? So yeah, there's a response to, I wish the rule said must not may. There's a lot of things we wish the public health code and the rules said. You don't know how well or unwell something works until you have to use it. And so this pandemic's been pretty eye-opening. So there is hope that when this is done, there'll be some rewriting, but we don't know if that'll actually happen or not because it is tricky. So, but I completely understand how fun this last week has been for all of you and for all of us. And so hang in there. Like I said, we're working to try to get some things made better and more uniform. I don't think it's going to help a whole lot with uniformity because, again, like, you know, a lot of health departments have just kind of gone rogue, and I don't think they'll come back from that. But we really appreciate those of you who have hung with us and tried to keep with a consistent message. I'll leave it at that, but I really appreciate all of you hanging in there. And we'll just hope these last few weeks go well and we come back next year with a lot more knowledge. So let me know if you guys have more questions along the way, and have a good rest of your week.